Hello, welcome to the GP Community Pharmacy Consultation Service event. My name is Melissa Burnley and I'm Head of Services for Community Pharmacy, West Yorkshire. It's a brief agenda for what the event's about. What is GP CPCS? An update on the rollout of GP CPCS in West Yorkshire, how to claim the Annex F payment, information on the resources available to support both your setup fee and service rollout. An introduction. The 5-year Community Pharmacy Contractual Framework sets out a clear vision for the community pharmacy services in line with proposals in the Community Pharmacy Forward View. The CPCS is the most important service in line with the 5-year agreement. Implementing this service has high importance to patients, NHS England, other healthcare professionals and community pharmacy. CPCS Overview. NHS Community Pharmacy Consultation Service launched on the 29th of October 2019 as an advanced service. Since the 1st of November, general practices have been able to refer patients for minor illness consultations via CPCS once a local referral pathway has been agreed. The service, which replaced NUMSAS and the DMERS pilots, connects patients who have a minor illness or need an urgent supply of medicine with the community pharmacy. As well as referrals from general practices, the service takes referrals to community pharmacy from NHS 111 and NHS 111 online for requests for urgent supply. Since COVID, patients referred to the CPCS are now being told to phone the pharmacy and speak to the pharmacist. This is a fantastic opportunity for pharmacies to be able to take patients and use this opportunity to use referrals without having to see patients face to face and still capitalise on this and use this as a service. If the consultation is conducted in this manner, the pharmacy is still eligible to claim a fee for the provision of this service. Here's a brief overview of the North East Yorkshire regional perspective. We've been very fortunate to have pilot areas in the North East Yorkshire, including West Yorkshire. 2 evaluations have been undertaken, focusing on patient experience, GP practice, staff and pharmacy feedback, with 84 feedback interviews and over 250 surveys. 97% of patients cited that they would use the service again. This has been really good and useful feedback because a lot of pharmacies have been concerned that once a patient has come into the service, that they would just go straight back to the pharmacy again without going via the GP practice, which means that they wouldn't use the service again and they would miss out on the referral fee. However, this service has shown that patients would still go via the GP and go through the referral, which means that they would still get the referral fee. It's estimated that 20 million GP practice appointments annually could be referred, and around an average of 55 appointments per week can improve capacity. North East Yorkshire region has funded a digital referral system, which I will go on to afterwards, and other referral pathways are being considered. GP referral is the biggest opportunity to improve capacity and has a fantastic opportunity for all GP practices, community pharmacies, and NHS England is really pushing this for all of our pharmacies. From the 1st of November 2020, CPCS was extended across England to include referrals for general practices as well as from NHS 111. GPs can refer patients to community pharmacies to receive a CPCS consultation for minor illnesses. Unlike NHS 111, GPs cannot refer patients for an urgent supply of a medicine or appliance. There is a video on here for pharmacies. Please have a look at it and please also share it with your general practices. The benefits on here. The benefits for patients is it's accessible, professional advice from the pharmacist of their choice. Minor ailments can be dealt with in a more timely manner. We educate patients to use the most appropriate health professional for their needs. Formal referral appointment rather than signposting. It's really important that patients are aware that it's an actual appointment. It's not just an over-the-counter signposting like it was before, when GPs used to just send patients to see their pharmacist for an over-the-counter signposting, advice. It's an actual appointment where they get to sit down with their pharmacist to have an appointment in their consultation room. Patient feels a lot more valued. General practice, it creates capacity. Like I mentioned before, 55 appointments can be released. Patients seen by the most appropriate healthcare professional at the right time. Build and enhance local working partnerships. It's really important that you have these conversations with your general practice. Make sure they realise that you have capacity to see these patients. Unlike a signposting service, GP CPCS allows GPs to see the outcome as well. So using these IT platforms, you can generate reports so that GPs can see what you are doing with their patients. You can share with them the outcomes, and GPs can see that their patients are getting the benefits as well. For pharmacy, allows community pharmacy to demonstrate its place within the NHS to help manage patients with minor illness, low acuity conditions, and build and enhance local working partnerships. Again, within the PCN, it's great for you all to work together and show as a PCN and within pharmacies and GPs, work together, show that you can all increase capacity within the NHS, and patients can be seen quicker, more effectively. Patients feel a lot more at the centre of the team. NHS, cost-effective use of NHS resources. National guidelines. Make sure that you've read the updated NHS CPCS toolkit for pharmacy staff so you understand more about how the pathway will operate, and also read the updated service spec. Make sure all staff have been briefed on the relevant changes to CPCS, and pharmacists that provide service read the updated toolkit and service spec. There's a lot of documents that are available now, so make sure that you've read all the new guidance and Royal Pharmaceutical Society and Royal College of General Practitioners toolkits as well. All the links are here on these slides as well for you. There's a lot of local digital support also for GP practices, which I mentioned earlier that NHS England is supporting all our GP practices in our area. This is free, and it is free and funded for a year. So digital solutions, so it provides lists of pharmacies signed up to provide CPCS close to the postcode inserted. It pulls in PDS data to streamline the process, which means that the GP practices don't have to manually input all patient data. It provides a tracker of the patient journey and the outcome, provides a full audit trail, and can provide system reports on referral activity. This is fantastic for all GP staff or NHS England pharmacy as well. So we can all see the outcomes of fantastic work that pharmacy teams are doing, fantastic work fantastic outcomes of patient data. It's from the pilot work that we've had so far on the digital solutions that's managed to get us this far with GP CPCS so that we can get the outcomes that we're having so far. As I mentioned earlier, regionally, NHS England have secured funding to enable an integrated solution for practices across North East and Yorkshire. EMIS web system users have got access to patient access, and System 1 and other users have got access to PharmRefer. The licenses for these tools are fixed period for 12 months of first instance, starting from when the practices go live. So where are we now in West Yorkshire for CPCS 111 referrals? So as you know, CPCS 111 has been going live since 2019. You can see from this graph here that we've got 493 CPCS pharmacies in West Yorkshire, which is fantastic because we've got about 550 plus pharmacies in West Yorkshire. So the majority of our pharmacies are already signed up for CPCS. We're having huge numbers of referrals now in West Yorkshire. Total 44,000 referrals are being sent through, which is great. So thank you to all of our pharmacies that are doing these referrals. This is great because GPs can see that we are doing the work. We're getting fantastic results, and pharmacies are actioning them, and patients are getting great outcomes. GP CPCS referrals, since we've gone live and since we've had the integrated platforms, you can see from here that GP practices are taking up the offer, and we're getting more and more practices about to go live and going live. And you can see again that pharmacies are completing referrals and patients are getting fantastic outcomes. So again, thank you for all the hard work that you're doing. As I mentioned earlier, we can see from the IT platform, you can track the data, and you can see on here that the majority of patients are getting advice only, or advice or sale of a medicine. So most patients don't need to be escalated or signposted. So pharmacies are managing to see the patients and manage the patients through by giving them advice and giving them the sale of a medicine without having to do any further escalating, which is great as well, because it means that these patients are managing to be seen and managed without having to go through any further escalation process, without having to go through any further NHS signposting, go back to the GP. So it's creating less workload for GPs, showing that patients and pharmacies are doing the work that they need to be done. So again, it's showing the GPs and the NHS that pharmacists are doing fantastic work. So thank you again for this. So it's really important that we agree local protocols. This is a really important step with GP CPCS. So it's part of your SOPs. It's important that you work with your GPs, that you have a referral method in place. So it's whether you're using Farm Outcomes, NHS Mail. How is the contact going to happen? Is the pharmacist going to work with your GP? Is the patient going to turn up? Are you going to contact the patient? What's the time scale going to be? Is it going to be within 4 hours, 3 hours? Is it going to be the next day? Are you going to have a professional phone line or backdoor number? Make sure you've got these in place already. If you haven't got any practices signed up, make sure you've still got protocols agreed in place anyway. So even if you've got no practices signed up anyway, you can still have your own protocol in place anyway, just in case you've got any practices that might go live. Make sure as a pharmacy you still have your own protocol in place just in case. So claiming the Annex F payments. So it can be claimed up to 30th of June 2021, £300, and it needs to be made via the NHS BSA Manage Your Service portal by the 5th of July. The requirements are detailed in the updated service spec. Again, the link's just set up there. So, Part A, the contractors participated in discussions with a delivery partner LPC lead. The webinar provides this, and there's all the details on here, and it includes planning the process for the rollout of the referral pathway. Should pharmacies be discussing GP CPCS with their practice? It's not mandated, but by all means, if an opportunity arises, please bear in mind current pressures and priorities. Avoid multiple approaches to the same practice. Please bear in mind that many practices are under a lot of pressure at the moment, and we are also working with the NHS England to work with the practices as well. So please bear this in mind at the moment. Part B for Annex F, the contractor has participated in meetings which may be web-based or organised by others to brief pharmacies. We are sending out a briefing as well to send you some more information to help you support that. I know that this webinar should help support you as well with that and provide you with some more information on where we are at the moment and how to help support you with further information on how to support you with the service. Again, make sure you speak to your GP practice, make sure you speak to your PCN, how to work out local pathways, because that's really important. Make sure you've got backdoor numbers, escalation, how to sort out urgent appointments, local rollout. They're all the things that are really important that you need for this part and Part B of the Annex F. Part C and D of Annex F is making sure that the pharmacy team have read and understood any briefing materials. So there's a really good action plan template for pharmacy teams that's on PSNC website, and there's a link to it on here. So making sure that you've got a record of any briefings that you've got. So on this action plan template, you can go through it with all the staff, and it's really easy and really clear, and you can tick off everything that you've done on here, and it should help you meet all the requirements on there. And you can create an action plan template based on anything that you're missing, that you've not met any of the requirements on there. So I highly recommend that you print off the action plan template and go through it with all the staff members on there. Annex F Part E, make sure that any relevant members of the pharmacy team are fully briefed. So again, if they've not read the service spec, make sure you've printed off the service spec, make sure you've read the toolkits, make sure you've gone through that action plan template again, because that's got everything that you need on there. Make sure you've gone through this webinar with the staff members as well. If you go onto the website for the NHS BSA, it's got the links on there that you need to, and tick off everything that you need to on there to make sure that all the staff have read everything that they need to meet the requirements on there. So when you feel that you've done everything that you need to, you've briefed all the staff, you've read all the parts of the toolkit, and you think you've met all the requirements that you need to for claiming Annex F, you can then go onto the MYS platform, and you can see on there, there's a section called GP Referral Pathway Declaration. So if you go on there, it can send you to a link to claim the payment. And then there's a section called GP CPCS Referral Pathway Declaration. And you can complete that section there to then claim your payment, to claim your £300. So make sure that that's done before the end of June or 5th of July. Feedback from the Bradford pilot that we were fortunate to have in our area was that it was really important to make sure that you have a really good working relationship with your GP practice. That was one thing that quite often we found, that it's important, if you want to make sure that you have a high number of referrals, make sure you speak to your GP practice regularly. Sometimes the GP practice thought that they were too busy, the pharmacy were too busy, so they didn't want to send referrals through. The GP practice thought that they didn't want referrals, they weren't sure what time to send referrals through. So make sure you have those conversations going regularly. Make sure you've got backdoor numbers going through. Make sure you've got regular conversations so that you don't have ambiguity at any point and misunderstanding at any point at all. And also speak to your PCN, speak to pharmacies in the PCN so that you can understand if there's any other problems in the area as well, so that you can work together and understand together what's going on in the area. So next steps, make sure that all members of the staff have read all the briefing materials. It is up to you to understand that you make sure that you meet the requirements of Annex F. It's not up to anyone else to understand. We've had loads of questions coming back to us as an LPC asking us if they think that they've met, if we think that they've met the requirements of Annex F. It's not up to us to answer that question. It's up to you to understand that. You need to make sure that you feel that you've met the requirements of Annex F. You need to keep a record of completion. You need to make sure that all your staff are fully briefed and fully understand what they need to do to be able to complete GP CPCS. So as long as you feel happy, you feel that you understand the service, there's lots of tools and lots of resources out there for everybody. And then you can complete your declaration and your payment. PSNC has got lots of tools there. We've put lots of links on the webinar, lots of links on our website as well. There's also lots of links with NHS England as well, which I've put on here on this slide. There's also on here lots of links for the GP staff. So if you feel that the GP staff need any help or any support, there's also lots of links on here for the GP staff. If you feel like any of the reception staff need any help, there's some links on here. Virtual Outcomes have done some really good training. So if you need any help on there, there's a really good training site there for GP staff, for them, and also for the pharmacy team there. So hopefully there's enough resource on there to help you meet the requirements that you need for meeting your declaration, for claiming your fee for the engagement fee, and also to help you meet everything you need for GP CPCS. Thank you for attending the webinar, and I hope you found it useful. Thank you.